So I'm Andy and this is Imoni, and our case was a 31-year-old woman with postpartum abdominal pain and fever.
Okay, so there's some relevant background in medical history. So she had surgery on her cervix 5 years earlier, ovarian cyst 3 years earlier. She had kidney stones 5 months prior, and she took oral contraceptives for about 12 years before getting pregnant. It also is important to note that she gave birth 10 days before her first hospital visit and then returned to the hospital 15 days after birth. So the patient presented with pain in the upper left quadrant 15 days after giving birth. The pain persisted post-antibiotic treatment, and she had a fever of 38.3 degrees Celsius, and there was a lesion on the liver greater than 10 centimeters.
So next we're going to run through some of the possible diagnoses that the doctors were looking at before they officially diagnosed her. But first I just wanted to go through some of the tests they ran. The first most important one is that she was positive for group B streptococcus bacteria, which is not a real big deal for her, but is somewhat important because she just gave birth, even though the people that wrote the article did not touch more on that. And then she was negative for everything else, which included syphilis, hepatitis B, gonorrhea, chlamydia, and HIV. And then on top of that, they also checked her blood and found that she had normal, for the most part, normal blood levels, but she did have a high white blood cell count when she first came in, which is consistent with just infection or inflammation and isn't a super big cause for concern.
Okay, so the first possible diagnosis was just a post-surgical complication, but this was highly unlikely after a vaginal birth. The patient will also demonstrate some type of uterine dehiscence, some retroperitoneal bleeding, or an injury to the organs. All of these were absent, and the patient did have a perineal laceration, but it was found to be intact. A thrombotic event also could have occurred, but based on the patient's history and examination, these are also highly unlikely, such as a deep vein thrombosis or pulmonary embolism. They also thought of a septic pelvic thrombosis or an ovarian vein thrombosis. However, these were ruled out because these are more common during like a C-section, and the pain would be in a different location. Now, these are the possible infections that were suggested based off the patient's symptoms and history. So endometritis is an inflammation infection of the uterus. It was suggested because of the classic triad of manifestations, which is fever, elevated white blood cell count, and abdominal pain. However, this infection is associated with a foul-smelling discharge and pain or tenderness near uterine fundus. The second infection was pyelonephritis, which is a urinary tract infection which would cause one or both the kidneys to become infected. This is common during pregnancy due to a hormone-mediated smooth muscle relaxation and uterine compression that increases urinary stasis, which is like urinary retention. However, the patient white blood cell count in urine was not as high as expected on day 15 for this type of infection. So after imaging and they saw the lesion, they decided to look at liver-specific diseases. The first thing possible was a hepatic infarction. However, they ruled this out because she did not have any hypovomic complications, and the image would have some type of wedge-shaped pattern, which was not on this patient's imaging.
So to go back for a second, on the first diagnosis, she was actually diagnosed with pyelonephritis, which is the infection of the kidneys that Imani talked about, and they treated her with antibiotics, but within 5 days she was back because of the return of the abdominal pain. And then when she returned, they did some imaging. On the left here is an ultrasound, and you can see the lesion that they found between the 3 arrows there. And then on the right is a CT scan, which is also a lesion, and the white circle is the necrotic area, with the area between the arrows being the hemorrhaged area. And then, so this was a greater than 10 centimeter lesion on the liver, and the patient was diagnosed with hepatic adenoma. They treated this lesion with exploratory lobotomy, left lateral segmentomy, and a resection of the hepatic mass. And then after this, she was recovered within 8 weeks of postpartum, and the patient reported no more abdominal pain or other symptoms. And then after this, when they took the removed resection out, this is 2 pictures of it, and it was 16 centimeters, which is very significant. And they sent it to the lab for further examination, and that confirmed what they saw in the images, where most of it was hemorrhage cells with some necrotic cells. And then they also found a very thin layer of tumor cells, and in her blood test she did not have any markers for tumors, which was good, but it is still good that they caught the thin layer of tumor cells before it spread. And that's all.